Good afternoon. Good afternoon, viewers. Welcome to Aster Volunteers COVID-19 webinar series. I'm Dr. Surya Jairam, a senior specialist with Aster Women's Health, Aster Medcity, Kochi. And what we are discussing today is coronavirus infection and its impact on pregnancy. So as we know, COVID-19 infection is spreading across the globe, and human race itself is going through an unprecedented crisis. We in India are facing a national shutdown, and people are complaining about sitting at home doing nothing, but we should understand that the effect of this national shutdown and the threat of coronavirus is even more. It impacts the pregnant population even more because they are also worried about their ongoing pregnancy and the growth of the baby. They'll have numerous, they'll be worried about their scheduled antenatal appointments, their scheduled scans, vaccinations, whether to go to hospital to see the doctor or not. So I'm sure all the pregnant ladies will have a lot of queries on their mind, anxieties on their mind, and to at least answer most of your queries, we have with us an expert on the subject, Dr. Maya Devi Kuru, a senior consultant with Aster Women's Health, Aster Medcity, Kochi. Welcome, madam.
Thank you.
So, madam will be telling us more about the do's and don'ts in this period of corona threat looming all over us. So, madam, the first question that comes to anybody when we think about corona, people are worried about whether they will be, how much is the risk of them being infected with corona, and there is this thought among pregnant women that they're more prone for infections, and once corona infection happens to them, they're more prone to its serious complications. Is there really a place for such a fear? ശരിക്കും corona infection അവരങ്ങനെ പേടിക്കേണ്ട കാര്യമുണ്ടോ?
To be honest, ഇതുവരെയുള്ള കണക്ക് വെച്ചിട്ട് I don't think there is അങ്ങനെ ഒരു ഫിയറിന് ആവശ്യമില്ലാന്ന്. Usually, pregnant women are vulnerable to infections, viral infections. For example, H1N1 അല്ലെങ്കിൽ swine flu, അതൊക്കെ വളരെ സീരിയസ് കോംപ്ലിക്കേഷൻസ് ആണ് pregnant women ഉണ്ടാക്കാറുള്ളത്. But the thing is, ഇതുവരെയുള്ള അറിവ് വെച്ചിട്ട് ഇതുവരെ നടന്നിട്ടുള്ള ഡെത്ത്സിന്റെ കണക്ക് നോക്കിയാൽ ഒരൊറ്റ മാതൃമരണം പോലും, that is no maternal deaths have occurred due to coronavirus.
ഒരു pregnant lady പോലും ഇതുവരെ coronavirus infection serious cases report ചെയ്തിട്ടുണ്ടെങ്കിൽ they have all survived.
So that means that even if a pregnant woman is affected with coronavirus infection, usually it is mild. അതുകൊണ്ട് സീരിയസ് കോംപ്ലിക്കേഷൻസ് ഇതുവരെ ഉണ്ടായതായിട്ട് കണ്ടിട്ടില്ല.
Are pregnant women more prone to the infection? Pregnancy infection കിട്ടാനുള്ള സാധ്യത കൂടുതലാണ്?
Definitely. They are vulnerable. Pregnancy itself a condition where they are vulnerable to any kind of infections. Similarly, coronavirus also, they are vulnerable to infections. So what we are expecting them is to follow the government guidelines. എന്തൊക്കെ ചെയ്യണം? That is stay at home, hand hygiene, പിന്നെ ബാക്കിയുള്ള ഇതുപോലെ തന്നെ സേഫ് ഡിസ്റ്റൻസിങ്, ഇങ്ങനത്തെ that will come. Social distancing is very important, അല്ലേ? അപ്പൊ അതൊക്കെ ചെയ്തുകൊണ്ടിരിക്കുക, because they are not supposed to get exposed to the coronavirus, and they should be very careful as well.
കൊറോണ ഇൻഫെക്ഷൻ കൊണ്ട് പ്രഗ്നൻസിയിൽ ഉണ്ടാകുന്ന പ്രശ്നങ്ങൾ എന്തൊക്കെയാണ്? നമ്മൾ എക്സ്പെക്ട് ചെയ്യുന്ന പ്രശ്നങ്ങൾ എന്തൊക്കെയാണ്?
യൂഷ്വലി ഇതുവരെ ഉള്ളത് വെച്ചിട്ട് ഞാൻ നേരത്തെ പറഞ്ഞതുപോലെ, there is no increased risk of miscarriage, there is no increased risk of teratogenicity.
Baby
affected, no teratogenicity or anything to the baby. And there is no vertical transmission, meaning there is no transmission of the virus from the mother to the growing fetus inside the uterus. So ഇതെല്ലാം വളരെ സന്തോഷമുള്ള കാര്യമാണ്. We can just ഒരു വൈറസ് അമ്മയിൽ നിന്ന് കുഞ്ഞിലേക്ക് പകരുന്നില്ല എന്നുള്ളത് നല്ലൊരു കാര്യം.
So even if the mother is infected with coronavirus, the baby need not be infected.
Yeah.
While it is inside
the womb. വെളിയിൽ വന്നു കഴിഞ്ഞാൽ കോൺടാക്ട് ഇൻഫെക്ഷൻ, that is different. ബട്ട് അകത്തുനിന്ന് അമ്മയിൽ നിന്നും കുഞ്ഞിന് കിട്ടുന്ന വെർട്ടിക്കൽ ട്രാൻസ്മിഷൻ ഇല്ല. പിന്നെ ഒരു മദറിന് ഇപ്പൊ ഒരു ഇൻഫെക്ഷൻ വന്നു കഴിഞ്ഞാൽ, എസ്പെഷ്യലി ആഫ്റ്റർ 28 weeks, ആ പ്രഗ്നൻസി അഡ്വാൻസ്ഡ് ആയി, അപ്പം ചെറിയ തോതിലെങ്കിലും ന്യൂമോണിയ പോലെയുള്ള കണ്ടീഷൻസ് വന്നാൽ, ലങ്സിനെ എഫക്ട് ചെയ്ത് കഴിഞ്ഞിട്ടുണ്ടെങ്കിൽ കുറച്ച് ബുദ്ധിമുട്ടുകൾ കൂടാനുള്ള
അഡ്വാൻസ് പ്രഗ്നൻസിയിൽ ഓൾറെഡി ലങ് കപ്പാസിറ്റി ഒക്കെ കുറയുന്ന അവസരത്തിൽ യൂട്രസ് വലുതാകുമ്പോൾ ലങ് കപ്പാസിറ്റി കുറയുന്നു എന്നുള്ളത് കൊണ്ട് അങ്ങനെ പ്രശ്നം വന്നാൽ അത് കൂടുതൽ സീരിയസ്
അങ്ങനെയുള്ള അവസരങ്ങൾ നമുക്ക് ചിലപ്പോൾ പിന്നെ പെട്ടെന്ന് ഡെലിവറി ചെയ്യേണ്ട ആവശ്യം വന്നിരിക്കാം.
So how do we actually reduce the risk of corona infection to pregnant women, especially in pregnancy?
Okay. So I think
we are all in a state of national shutdown. Most of the people are sitting at home, but still, what can we do to reduce the infection?
Okay, fine. I think the viewers are asking for more of English than Malayalam, so we'll talk in English. Thing is, you'll have to stay at home, and when you are staying at home, if you are a working woman, you will try to work from home. But now it is national shutdown, so you don't have to worry about that. At home as well, you will have to keep away from the rest of the family members as far as possible. You can have your own space, you be in your room, but at the same time, you should have a discipline in your life. Being at home doesn't mean that you can go to sleep late at night and get up late, like 10 o'clock or something. No, you should have a discipline. You should be getting up early in the morning, have your normal breakfast, like that. You should have a discipline in your day-to-day life.
You should basically follow a routine as you used to do before the shutdown.
Yeah. And another thing is, if you have been doing exercises, you should continue doing it at home. And especially yoga, you can do at home. You can have online sessions, so you can do any kind of exercise at home. And eating habits as well. When you are at home, you will have a tendency to eat more, but you have to keep a healthy diet when you are at home. And listen to music, whatever you like. Reading, because now reading habits are gone. Especially when you are working, you won't have the time to read. Now you should take advantage of this staying at home and to engage yourself in whatever you leisures that you had before, like singing or dancing or reading or whatever, or watching movies. But don't watch movies like Contagion. That will be very negative. But watching some light-hearted movie, something like that, it will definitely help you relax.
Maybe even when you watch news, make sure you gather the information correctly rather than going after fake news and misinformation and getting yourself worked up into a panic state.
And also WhatsApp messages. Please don't go through the negative WhatsApp messages. There are fake messages. You will get plenty of fake messages as well, which are all negative. So definitely don't go through those. That's my advice.
So basically, to protect yourself from infection, even at home, you have to maintain social distancing. You to keep yourself mentally and physically active by doing things that you love, and maintain a healthy diet and a regular exercise regimen. And madam, what about the antenatal appointments? As we know, we expect pregnant women to come to hospital for scheduled visits. We do bring them in the first trimester every 1 month, and then every 2 weeks, and then after 36 weeks, we expect them to come every week or so. Okay. So this is in a low-risk woman. So how will you schedule the antenatal appointments for these women, and what are the precautions that they should take before they come to the hospital?
Better to limit the appointments, hospital appointments. You can have on-call consultations. All of us, all obstetricians are now giving your numbers. They can contact you through the hospital or personally, and then they can discuss their own concerns and everything. And well-being also, we can discuss over the phone. So if everything is okay, they need to attend only the scanning sessions, which are very important, like the third month scan, the 5-week anomaly scan, then growth scans. So if everything is okay for a normal pregnancy, 28 weeks scan. After that, you need to see they need to have come for the 36-week scan alone. And in between, you can have telephone consultations.
Just see whether the baby is moving normally. Yeah. They can have the blood pressures monitored at home. Yeah. Watch for the other problematic signs, such as too much of edema on their limbs or other signs. Yeah. We can tell them to inform us that the BP is high. And the vaccinations can also be scheduled along with these visits, right?
Yeah.
We will go over the routine vaccination.
Yeah. About the blood sugar monitoring and all. Sometimes patients with the abnormal glucose tolerance test. So we'll have to keep them diary with their fasting blood sugars that the endocrinologist must have given them. That they'll have to be very strict about it, and they'll have to consult their own doctors.
They can always call up the doctors, WhatsApp them. We are all available for telephonic consultations, and we'll go about the routine vaccinations. The vaccinations will be scheduled scheduled according to these visits when we bring them in for the scans.
Yeah.
And
I can see one of the questions is that the patient is in the third trimester. So
is it okay to visit a hospital for a checkup now?
Yeah, they can, if it is needed, definitely they should come for the appointment. As I said, at the third 6 week scan, they'll have to come.
They should maybe call up the hospital or the doctor and find out whether the scan slot is available, whether they actually need to come in right now. And if everything is going fine, the doctor may ask them to just sit at home.
Yeah.
If a scan is not necessary at that point.
And safety precautions they have asked. Safety precautions, if it is necessary for them to attend the hospital visit, like any other patient coming to hospital, wear a mask and please try to avoid contact with anybody having cough or fever, and hand hygiene. Wherever you touch, you have to use the hand sanitizer and or use soap and water to clean your hands, and don't touch your face several times with your finger. That is the most important thing. Even if you use hand sanitizers, but still try to avoid touching your face with the fingers.
Maybe when they come to hospital, they can limit the number of people who accompany them. Only one person or so should accompany them.
Yeah, maximum one person, and try to avoid bringing children and elderly to the hospital. Very important.
Definitely. If you are in your second pregnancy, try to avoid bringing your elder child to the hospital. And when you bring a person with you, make sure that that person is not somebody who has returned from a foreign country, who's prone to develop corona infection, or somebody who's not, somebody who's supposed to be locked up in a quarantine. So make sure you choose your accompanying person well, and take these precautions when you come to the hospital.
Try to use public transport. It's better that you have your own vehicle if you're coming to the hospital. And if that is not available, you should ring up the hospital and see if they can arrange transportation for them.
And these are about the scheduled visits, madam. What if there is an emergency in between? What if they have a bout bleeding or a pain abdomen, which is like a threatened preterm labor or something? What should they do?
Any emergency, they'll have to still call the doctor, hospital, and straight away come to the hospital. They shouldn't sit at home.
And what should be done if a pregnant lady is exposed to a person with corona infection?
They should call their doctor or the Disha helpline. The helpline number is 1056 in Kerala. So they will see the patient and decide whether the patient needs a home quarantine or a hospital isolation, depending on what they find. Okay.
So
if they are home quarantine, as I said before, if they are home quarantine, whoever is staying with them will also need to be quarantined for the next 14 days. They should limit they shouldn't go out and contact with other people.
And even if they have a scheduled appointment at that time, it would be wiser to shift the appointment to later. Until the government agencies give a clearance to them to get out of the house and go to the hospital, unless there is an emergency.
And then at home, that person shouldn't be mingling with the rest of the. They'll be staying in their own room, and they shouldn't be actually having food with the rest of the family.
They should have separate utensils,
separate towels. Everything should be separate until the quarantine is over.
And they should preferably stay in a well-ventilated room with the bathroom attached, so that they don't have to move out of the room at all. And what if the patient becomes positive?
If the patient becomes positive, that patient should be definitely admitted in isolation wards in COVID centers. There are certain designated COVID centers. They will be treated there, and they will be appropriately taken care of by trained personnel there. So, and if they are near term or they are nearing delivery, then definitely their delivery will be taken care of in that isolation wards.
And those centers will have facilities for delivery.
Yes, they'll have the personnel, the doctors with PP, all those things, and they'll be looking after the patient. What they'll be looking after is that with coronavirus infected women, they can develop, as I said before, they can affect the lungs. In that case, sometimes they can have breathing difficulties. Yeah. So we need facilities to monitor their oxygen saturation during labor. We'll have to monitor the baby as well. So continuous fetal heart rate monitoring will also be needed.
Does being infected with corona mean that the patient cannot have a normal delivery? Will she need a C-section as a case of H1N1 and most of the women?
Nothing like that. They can have a vaginal delivery if everything goes well. Unless if they have any problems with their respiration or anything needing or there is another obstetric cause for a cesarean section, then definitely they should go for a cesarean section. Otherwise, they can have a normal delivery. As I said before, there is no vertical transmission. The baby won't be affected when they are having a vaginal delivery or anything like that. But after delivery, the baby will be tested for coronavirus infection.
Okay, the baby will be tested.
Yeah, baby will be definitely tested.
And can the woman breastfeed the baby?
They can breastfeed the baby. While breastfeeding the baby, they'll have to take special precautions. The mother should wash their hands with soap and water or hand sanitizer, and whatever, if they are using the breast pumps, that should be cleaned properly. Bottle should be cleaned properly, and the mother should be wearing a mask. And because if she coughs or anything onto the baby,
she should not cough or sneeze onto the baby.
The mother can ask express breast milk to be given to the baby by
a person who's not affected, so that the baby is not exposed. Is there any chance that the baby can be infected through the breast milk?
No. Actually, studies have not suggest that there is any transmission of the virus through breast milk. But I don't know, but these are the studies. But a few studies here and there saying that there is a slight risk, but nothing has been proven so far.
So it is safe to breastfeed. Madam, are there any vaccinations available for preventing this infection? That's another question going around, asking whether the routine flu vaccine which we used to take for H1N1, does it have a kind of protective effect on coronavirus infection?
Unfortunately, we don't have any vaccines for coronavirus so far, but research is going on. People are working very hard to find a vaccine for that. So we are hoping that we might find one, but it will take time.
And what about the treatment part, madam? The drugs being used. If the patient becomes infected, are the drugs being used currently to treat corona infection safe in pregnancy? And there is a lot of queries going around as to whether hydroxychloroquine, which is recommended by ICMR for healthcare professionals exposed to coronavirus infection, many patients keep on asking whether they should start on HCQ. Is it advisable?
It's not advisable. No treatment has been so far. We have started giving for pregnant women for coronavirus pregnancy. But again, as like vaccinations, trials are running, and I have listened to one of the famous oncologists, Dr. M. Pinda's interview recently, and he has said these viruses are very clever. So if you try one medicine, like people are saying that the any other antiviral virus, if you just give for treating corona, might be helpful, but they are very clever and they'll develop resistance fast. So whatever you are giving, we should try to have a cocktail of medications just to keep them or just to
keep the virus susceptible to these drugs.
Yes, that is the most important thing.
And maybe the indiscriminate use of these drugs for prophylaxis will reduce its effectiveness.
Yeah, and these prophylaxis drugs, people think that anybody can take it. No, actually it is not for use for everybody. It's actually for those health professionals who are exposed to coronavirus infection. It has been
and for close contacts, even
healthcare
professionals or close contacts, these drugs are advised. So indiscriminate use of
and
these
that
drugs
too, you have to assess various things because it has got various side effects. So we have to assess. Only a doctor can assess a person whether he should be receiving the hydroxychloroquine medication. Otherwise, you can't just take it. I'm hearing people saying that anybody can take the hydroxychloroquine, which is not right.
So if at all it is necessary, it should be taken only under medical supervision because of the adverse effects it can cause.
ഇനി ബാക്ക് ടു നമ്മൾ കുറച്ച് മലയാളത്തിൽ പറയാം നമ്മുടെ ആൾക്കാർക്ക് വേണ്ടിയിട്ട്. അപ്പോൾ ഈ കൊറോണ വൈറസ് പ്രഗ്നൻസിയിൽ വന്നു എന്ന് വിചാരിച്ചിട്ട് എല്ലാവരും പരിഭ്രാന്തരാകേണ്ട ആവശ്യമില്ല. കാരണം നമുക്ക് ഇതുവരെയുള്ള കേസുകളൊക്കെ എടുത്തു നോക്കിയിട്ടുണ്ടെങ്കിലും വലിയ കുഴപ്പമൊന്നും കണ്ടിട്ടില്ല പ്രഗ്നൻസിയിൽ വന്നിട്ടുള്ളവർക്ക്. അത് കാരണം നമ്മൾ കുറച്ചും കൂടി കരുതലുണ്ടാക്കണം. അതായത് ഗവൺമെന്റ് പറയുന്നത് പോലെ, നിർദ്ദേശിക്കുന്നത് പോലെയുള്ള എല്ലാ കരുതലുകളും കൂടി എടുത്തിട്ട് നമ്മൾ സെൽഫ് ഐസൊലേഷനോ ഹോസ്പിറ്റൽ ഐസൊലേഷനോ വാട്ടെവർ നമ്മളോട് അഡ്വൈസ് ചെയ്യുന്നത് അനുസരിച്ച് അതേപോലെ നമ്മൾ മുന്നോട്ട് പോകണം. അങ്ങനെയാണെങ്കിൽ ഡെഫിനറ്റ്ലി നമുക്കിതിനെ ചേർന്ന് നിൽക്കാൻ സാധിക്കും. പിന്നെ മറ്റു കാരണങ്ങൾ എന്താണെന്ന് വെച്ചാൽ, എല്ലാവരും വിചാരിക്കുന്നത് എനിക്ക് പ്രഗ്നന്റ് ആയി കഴിഞ്ഞിട്ടുണ്ടെങ്കിൽ കൊറോണ വൈറസ് വന്നു കഴിഞ്ഞാൽ കഴിഞ്ഞു, എല്ലാം കഴിഞ്ഞു എന്നുള്ള അങ്ങനെയൊന്നും വിചാരിക്കേണ്ട കാര്യമില്ല, പേടിക്കേണ്ട കാര്യമില്ല. അത് ആവർത്തിച്ച് പറയുന്നത് എന്താ വെച്ചാൽ, നിങ്ങളുടെ ഡോക്ടർമാരെ നിങ്ങൾക്ക് ഫോണിൽ കോൺടാക്ട് ചെയ്യാം, നിങ്ങൾക്ക് സംസാരിക്കാം, നിങ്ങൾ എത്ര പ്രാവശ്യം ഹോസ്പിറ്റലിൽ വരണം എന്നുള്ളത് നിങ്ങൾക്ക് ചോദിച്ച് മനസ്സിലാക്കാനും സാധിക്കും. അവർ നിർദ്ദേശിക്കും നിങ്ങളോട്, നിങ്ങൾ വീട്ടിൽ തന്നെ ഇരുന്നാൽ മതി എന്നും എത്ര പ്രാവശ്യം വരണം എന്നുള്ളതൊക്കെ. അതിപ്പോൾ നേരത്തെ ഞാൻ പറഞ്ഞു, ഇംഗ്ലീഷിൽ പറയേണ്ടത് വന്നുകൊണ്ട് നേരത്തെ പറഞ്ഞു. എന്നാലും പറയുകയാണ്, നിങ്ങളുടെ സ്കാനുകളൊന്നും നിങ്ങൾ മുടക്കരുത്. അതായത് പിന്നെ NT സ്കാൻ എന്ന് പറയുന്ന 12 ആഴ്ചയിൽ ചെയ്യുന്ന സ്കാൻ, 20 ആഴ്ചയിൽ ചെയ്യുന്ന അനോമലി സ്കാൻ, പിന്നെ ഗ്രോത്ത് സ്കാൻസ്. അത് ഒരു എന്തെങ്കിലും ഗ്രോത്തിന്, ബേബിക്ക് ഗ്രോത്തിന് പ്രശ്നമുള്ളതാണെങ്കിൽ 28, 32, 36 ആഴ്ചകൾ ചെയ്യേണ്ടി വരും. പക്ഷെ ഒന്നുമില്ലാത്ത ആൾക്കാരാണെങ്കിൽ 28 ആഴ്ചയിലും, ലോ റിസ്ക് ആയിട്ടുള്ളവർക്ക് 28 ആഴ്ചയിലും 36 ആഴ്ചയിലും മതിയായിരിക്കും. അത് തീരുമാനിക്കേണ്ടത് നിങ്ങളുടെ ഡോക്ടറാണ്. അപ്പൊ നിങ്ങളുടെ ഡോക്ടറിനെ വിളിച്ച് ചോദിക്കുക. പിന്നെ നിങ്ങൾക്ക് എന്തെങ്കിലും സംശയം, അതായത് നിങ്ങൾക്ക് വെളിയിൽ നിന്നും വന്നവരായിട്ടുള്ള കോണ്ടാക്ട് എന്തെങ്കിലും ഉണ്ടെങ്കിൽ, നിങ്ങളുടെ വീട്ടിൽ തന്നെ ആരെങ്കിലും ഉണ്ടെങ്കിൽ, അങ്ങനെ എന്തെങ്കിലും സംശയം വന്നാൽ നിങ്ങളുടെ ഡോക്ടറെയോ ദിശ ഹെൽപ്പ് ലൈനെയോ 1056-1056 നമ്പറിൽ എപ്പോൾ വേണമെങ്കിലും ബന്ധപ്പെടാവുന്നതാണ്. അവരും നിങ്ങളുടെ എല്ലാ സംശയങ്ങളും പിന്നെ എന്ത് വേണമെങ്കിലും അവർ ചോദിച്ച് മനസ്സിലാക്കാം. നിങ്ങളെ കാണേണ്ടതാണെങ്കിൽ അവർ നിങ്ങളെ അവിടെ വിളിച്ചു വരുത്തും. ഫീവർ ക്ലിനിക്സ് ഉണ്ട്, അവിടെ നോക്കും. അതിനനുസരിച്ച് നിങ്ങൾക്ക് ഹോം ക്വാറന്റൈൻ വേണമെന്നോ, വീട്ടിൽ നിൽക്കണോ അതോ ഹോസ്പിറ്റലിൽ നിൽക്കണോ എന്നെല്ലാം പറഞ്ഞു തരും. ഇനി നിങ്ങൾക്ക് വന്നു കഴിഞ്ഞാൽ തന്നെ നിങ്ങളെ പരിചരിക്കാൻ വളരെ വിദഗ്ധരായ ഒരു ടീം തന്നെ എല്ലാ സ്ഥലത്തും പല പല ആശുപത്രികളിലായിട്ട് സജ്ജീകരിച്ചിട്ടുണ്ട്. അതുകൊണ്ട് ദയവേത് നിങ്ങളാരും പേടിക്കരുത്. പേടിച്ചിട്ട് ഈ ഒരു കൊറോണ വൈറസ് എന്നുള്ളതിനെ പേടിക്കുന്നതിൽ നിന്ന് മാറി നിൽക്കുക. പകരം പ്രഗ്നൻസി എന്നുള്ള സമയത്ത് നിങ്ങൾ ഈ വീട്ടിലിരിക്കുന്ന സമയം കൂടുതൽ റിലാക്സേഷനിലോട്ട് പോകുക. പാട്ട് കേൾക്കുക, വായിക്കുക, നല്ല നല്ല സിനിമകളൊക്കെ കാണാം. അങ്ങനെ കുറച്ച് എന്താ പറയുക, ലാഘവത്തോട് കൂടിയിട്ട് എടുക്കുക. പക്ഷേ സീരിയസ്നെസ് ഒട്ടും കളയാത്തത്. വേറെന്താ ഉണ്ടെന്ന് സൂര്യക്ക് ചോദിക്കുന്നത്?
നമ്മുടെ വ്യൂവേഴ്സിന് വേറെ ക്വസ്റ്റ്യൻസ് ഒന്നും കാണുന്നില്ല. പക്ഷെ വളരെ കോമൺ ആയി ചോദിച്ചിരുന്ന വേറൊരു ക്വസ്റ്റ്യൻ ആണ്, കൊറോണ വൈറസ് ഇൻഫെക്ഷൻ ബാധിച്ചു കഴിഞ്ഞാൽ ലേബർ എപ്പിഡ്യൂറൽ, പെയിൻലെസ് ലേബർ, NGOs ഇതൊക്കെ എടുക്കുന്നതിന് പ്രോബ്ലംസ് ഉണ്ടോ എന്നുള്ളത്.
ഇല്ല, ഒരു കുഴപ്പമില്ല. പിന്നെ ഏത് തരത്തിലുള്ള പിന്നെ അനാൽജസിയ എന്ത് വേണമെങ്കിലും എടുക്കാൻ പറ്റും. എസ്പെഷ്യലി NGOs ഉള്ള സ്ഥലങ്ങളിൽ അത് ഉപയോഗിക്കാം. എപ്പിഡ്യൂറൽ എടുക്കുന്നതിന് ഒരു കുഴപ്പമില്ല. പെയിൻലെസ് ലേബർ ഒരു കുഴപ്പമില്ല, നിങ്ങൾക്ക് എടുക്കാവുന്നതാണ്.
വേറെ വ്യൂവേഴ്സ് ചോദിച്ചിട്ടുണ്ട്. ഗൗതമി M has asked whether there is an increased risk of miscarriage or preterm labor.
ഇല്ല, അതാ നേരത്തെ ഞാൻ പറഞ്ഞതാണ്. There is no increased risk of miscarriage. There is no increased risk of preterm labor due to coronavirus.
There are people who are overeating at home, whether the cravings are due to coronavirus infection.
I answered the question before. Actually, when you are at home, you should have a discipline on what you eat as well. Lifestyle you shouldn't change. Actually, you should have a discipline in when you should be getting up, when you should be going to sleep. All those things you can't just take it easily and then get up at 10 o'clock in the morning and sit late until 12 o'clock midnight. Nothing. That is not advisable. You should have a perfect discipline in your life, in your what you eat as well. Healthy eating is very important.
Fatima Ali is 10 weeks pregnant and is having fever and cough. Should I take a COVID test? Is a question.
Any pregnant lady with fever, high grade fever and cough, you should contact your doctor, and your doctor will direct you to go to the fever clinic and get tested.
Being in third trimester, Poonam has been advised to go for walks twice a day. Is it safe to do so?
In India, it is not possible because it is a national lockdown. You can have your exercise walk inside your house. You can try other exercise like yoga at home.
So she should ideally be contacting a fever clinic. Fatima Ali should ideally be contacting a fever clinic right now for her fever and cough right now. And then there is another person who's asked whether having a home delivery will be safer, whether it will be safer compared to hospital delivery at this time.
not advisable. It's better to be at home.
Home delivery definitely carries its own risk. Hospital delivery is done so that there are doctors and healthcare staff available to take care of any possible complications in pregnancy.
Where is she
So
actually
even at
located?
these times, I don't think a home delivery will be advisable. Exercises to be followed by 34-year-old who's in third trimester for free delivery. You can contact your doctor who will know your details better and who can tell you what kind of exercises is better for you. So I think that's all.
I think not
So,
many. I have
The most
vitamins.
important thing I think right now is any pregnant patient with a fever or cough or any symptoms of corona should definitely contact the doctor immediately. They should not be visiting any OPDs. They should not be coming to antenatal OPDs. They should be coming to emergency. They should have informed the doctor prior, and in these cases, these patients will be taken to fever clinic directly without them being put in contact with other patients. So the most important thing is they shouldn't go to OP directly. They should inform the doctor and go to emergency, and they should be seen in an isolation. And further testing will be needed. Hopefully, it turns out to be just a simple cough and fever and not corona. But still, you need to be seen by a doctor to make sure that it is not corona.
Even not seen, you can just phone your doctor and assess the situation. If it is
Wherever you are,
mild fever, just like a mild fever, they can take paracetamol and then see whether, if it is high grade fever, definitely they should come to the fever clinic and get tested. But there is no point in testing all pregnant women for coronavirus. That is not practical and that is not necessary. That is that you should also understand. Any more questions? I think
it's safe to buy dairy products.
Everybody is worried about buying things from outside. Whatever you have been, and if it is safe, you will get all things delivered to your door. If one more thing I want to emphasize is that if you are having home quarantine, they should ask their friends or relatives to get stuff for them, and they can ask them to deliver it outside their door. They shouldn't be coming inside. They can keep it outside and then do. That is how we are doing it everywhere. Any other questions? All dairy products are from outside. I think from reliable
manufacturers,
you can still buy it. But please don't raw milk and everything from, I don't know whether you'll be getting it from outside. I think there are people from various places, so that is why we are not used to certain questions what they are asking. Any
it's non-alcohol hand wash or sanitizer, which is better. What has been advised is sanitizer with at least 20% alcohol content, and definitely washing your hands for 20 minutes with a good soap and water is what is advised. This should be done every 2 to 3 hours. And you can use a sanitizer in between. And when you buy sanitizer, always buy a sanitizer which contains at least 20% alcohol.
And if you use the hand sanitizer many times, it will keep your hands dry. So that is why in between you wash with soap and water, even if you are using, and especially for those going to hospitals and all, wherever they touch and then they'll be using the hand sanitizer. But after 4 or 5 times, it's better that you wash with soap and water. Better. So, എനിക്ക് തോന്നുന്നു നമ്മൾ almost എല്ലാ കാര്യങ്ങളും നമ്മൾ പറഞ്ഞു എന്നാണ് cover ചെയ്യുന്നത്.
Somebody has asked whether we use mostly soap to get a safe answer. Definitely, well, using soap and water properly, that is washing your hands at least 20 seconds every 2 or 3 hours.
Washing is also, you need to know how you wash it. It is like you have to cover the entire hand like
all
that. All the surfaces, like the in between the fingers and then both, all these areas. So only if you wash like that, then your hands will be sanitized. Otherwise, there's no point in just something like this washing. It has to be a proper hand washing.
So Somebody else has asked. Poonam has asked whether vitamin C will help increase
Definitely,
immunity.
vitamin C will increase your immunity every time. You can take it. There's no harm in taking it. So the main reason for breastfeeding, we allow breastfeeding, is that the baby needs immunity transfer from the breast milk. So that is the main reason we encourage even patients with coronavirus to breastfeed their babies, taking all precautions. The baby should get the immunity from breast milk.
How many days post-delivery will a pregnant woman be allowed to get discharged with the mother and child have to stay
If
in
they
hospital?
are in quarantine period there, they should stay in the hospital until the corona tests are negative. They have to be in the hospital until tests are negative. They can't. They won't be discharged home. But
If it is a
corona positive
non-infected patient, the policy now is to discharge all patients as early as possible. Depends upon how your delivery, whether it was normal delivery or a cesarean section, and how things went during the delivery of C-section. But right now, what we are trying to do was to keep the hospital stay to a minimum for all patients, and definitely without compromising the patient safety. Looks like we have answered all the questions.
I think we have answered. I think we have answered all the questions.
Somebody has asked whether a pregnant woman drinking hot water to reduce cough. Can a pregnant woman drink hot water to reduce cough?
You can
There's
drink
no
hot water.
harm in drinking.
You can drink hot water.
Zinc supplements. None of these are proven to protect you. Even vitamin C, zinc, none of these things have a proven effect in protecting you from coronavirus infection. There is no harm in taking these things.
Somebody has asked whether they are taking vitamin C tablets twice a day in third trimester. There's nothing like that. You can take one tablet a day, will be fine. It's not going to have additional immunity. Outside food is not advisable for pregnant women. That I agree. It's better that you have food cooked at home
But
itself.
whatever is available, you cook up a healthy meal and eat that. That will definitely be better.
Somebody was
KFC is stopped
eating
from
from KFC.
No, anyway, KFC is not available here.
Here in Kerala, it's lockdown, so
I'm pregnant and Gautami is pregnant and she's a healthcare worker. Can I work with patients who are potentially infected with COVID-19?
no, I think you shouldn't be. You are pregnant.
Ideally pregnant women should be
Sitting at home, you shouldn't be working.
ideal situation. You shouldn't be exposed to potentially COVID-19 positive patients.
Precautions to take. Any this is 6-month-old baby. Any precautions to take? It's like any general population. You have to take all precautions. Treat your
Random cough, definitely pediatrician should be contacted. We have answered most of the other queries. Madam, we have answered most of the other queries, it seems.
Okay.
So, what are the ways one can calm a pregnant member of the family if they're stressed about corona?
That we have been discussing through the entire program here. You need to relax. You shouldn't be panicking. Don't think about corona. Don't watch television program
News
or news too much, and negative thoughts about corona, all those things you should try to avoid, and try to relax, listening to music, listening to
Has asked whether she can.
or watching fun movies, reading, all those things you can do now. This is the best time that you should be utilizing to relax.
Poonam Rao has asked whether she can travel to her mother's place, which is about 150 kilometers away after her delivery.
It depends on how the situation will be after her delivery. At the moment, we can't
Right
say
now we
anything.
can't
Right now,
advise
we
her to
can't say
travel.
it's a lockdown time, so we can't advise anything like that. So better wait and see. Hopefully, we'll be able to. We'll be coming out of the lockdown period in a couple of weeks' time. We'll see. Vaccinations, you have to contact your neonatologist and then decide when your baby will be vaccinated. All these things can be done over the telephone, and then you can contact your doctor and decide. So,
But for us, the vaccinations in pregnancy, we do continue with the vaccinations.
vaccinations in pregnancy is different. Somebody has asked
For
about
the babies'
vaccination for the
vaccines, I think
babies.
in some places, routine vaccination,
Yeah, that we can
vaccinations are
contact
being
their
put
own
on hold.
hospital.
Maybe that is the reason for the question.
We are giving vaccinations in pregnancy. We have not stopped.
You do get calls from many people asking whether there is this thing in Kerala where the pregnant lady will be taken to her mother's house by around 7 months. So we do get calls asking whether we can give them permission to travel to their parents'
We
place.
can't. Unfortunately, we can't now. At this stage, we are not telling anybody to get out of their house. They have to stay there. Wherever they are, stay there. That is the government guidelines that we have to follow that. Have you missed anything, Surya? Can't remember.
Looks like we covered everything, madam. We'll wait a few more minutes and see if any more new questions come up. Let's take a hospital for injections. Okay, let's see.
What kind of injections, whether it is only, you have to, again, all these baby stuff, you have to call your own doctors and find out whether it is needed, what they should be doing about it.
Somebody has asked whether it's a previous miscarriage has scarred my wife and now she's getting paranoid because of the pandemic. Is there any medication to help her de-stress?
Don't give her any medications as such, but you should try to reassure her. Because what is the point in worrying about corona and another pregnancy? Okay, so you have to reassure her, you have to tell her that the pandemic will be controlling the pandemic soon. Be positive about it. We are all positive about it. That is how we, otherwise, we won't be able to tide over the situation. So, whatever she likes, we have to keep her get engaged in rather than thinking about corona alone.
What are the precautions to be taken when shifting a pregnant woman to the hospital?
Take your own transportation or hospital call. If you don't have your own transportation, you can call the hospital and they'll be arranging an ambulance to shift pregnant woman to the hospital. And same guidelines, hand hygiene, wear a mask, and safe distance you have to keep with others. That's all. You don't have to have any other precaution. The precautions will be taken care of by, I don't know whether if you are not exposed to the coronavirus, you don't have to worry too much.
Next 2 weeks have to go to for anomaly
Anomaly scan, you
and
shouldn't
vaccine.
miss. Anomaly scan, you shouldn't miss. Vaccination also, you can arrange, you can actually, when you're going for the anomaly scan, you can get your vaccination along with that. Aditi, you should be you should be traveling in your own vehicle, or don't try any public transport. You won't get any public transport in the next 2 weeks. So, or if you have time to postpone your anomaly scan, if you have got time for up to 20 weeks, you can do the anomaly scan, you can postpone it. Devanand has asked about the precautions to be taken while shifting a pregnant woman. Again, like we said before, try to avoid the number of accompanying
people.
Only one person will be more than enough. Elderly and children to be avoided.
And that too, anomaly scan and NT scan are 2 scans that should never be missed. Try and not to miss those 2 scans, right, ma'am?
There's no point in keeping on worrying about coronavirus affecting. It can affect anybody, but please don't try to be negative. Always try to be positive. That's the only way. Age is not a barrier. It says that, although we were saying initially that the elderly are affected mostly, but it can affect anybody. As long as you try to take all the precautions and try to avoid getting the infection, that's the most important thing. We are all working, we are all coming to hospital, but we are taking precautions not to get the virus. So, I think
So looks like we don't have any more queries, madam. Is there anything else you would
nothing.
like to tell
Don't
them?
panic. So we will be able to, get over the situation, and corona will be eradicated from the entire world soon. And let us
We win this battle.
break the chain.